Good evening, everyone. Wynn Brown here with Haywood Healthcare's COVID-19 update for June 10th, Wednesday. Hope you all had a great day out there. I've got a lot of things to report tonight, so I'm going to put my cheaters on so that I can make sure that I tell you everything I need to. First, let's just take a look at our testing. We have tested a total of 6,021 patients, and we've got 5,344 back with negative results, 496 positive, 72 indeterminate. Our cumulative rate is 8.4% versus the state at 15.8%. And our 10-day positive rate for a rolling average rate is 1.79%. And the state 10-day rolling average is 4.81% as of yesterday. In Worcester County, 11,803 cases with 834 deaths. Franklin County at 341 for its cases and 49 deaths. There is a chart that's going to be embedded with this email, and you'll be able to see our 10-day rolling average, and you can see the bell curve and the tail that's going out from that right now. I know some of you are really data wonks and want to know what's going on, and so we are providing that with you. Tomorrow, just to let all staff know, and many staff do know, but we are going to have a collective period of silence across the health system to recognize and celebrate Black Lives Matter. And so we'll do that at 12 noon and to look at to really reflect on the innocent lives lost to unacceptable acts of racism. And so what will happen is, as a healthcare system, there'll be an overhead announcement at noon and inviting everybody in the healthcare system to pause for a period of reflection and solidarity, and then there'll be a chime that will start that for 8 minutes and 46 seconds, which, as you know, is the amount of time that Mr. Floyd was being asphyxiated by the policeman through police brutality, which is why there's so much going on in our country right now, and our staff want to be a part of that and recognize that, and so we are happy to support that. So tomorrow at noon, we will have a collective period of silence for that. Some information on eyewear for staff and eye protection. So a little change up in our stance on that and our advisory on that. So I'm going to just read it. Don wants to make sure I have it correct. Healthcare workers who have face-to-face contact with patients are strongly encouraged to wear eyewear protection, face shields, or goggles when within 6 feet of a patient. This is a precautionary recommendation above and beyond the DPH and CDC guidelines. Anyone needing a shield should see their manager. In addition to shields, will be at the entrances for entrance control staff as well. And when you do get a shield or goggles, you should put your name on it and label it as your own. They can be reused and cleaned daily with alcohol wipes and other appropriate disinfecting agents. So just a change on our eye protection recommendations. Also, with the opening of phase 2 of the governor's order, one of those things had to do with visitors and allowed more flexibility for hospitals to allow visitors to be with patients, inpatient and escorting to appointments. We are going to continue with our general policy on visitor restrictions, except in circumstances that revolve around guardianship, caregivers who have to be at the bedside, comfort care measures, laboring mothers, those kinds of things. When the reason we're not fully lifting the restrictions so that everybody can have a visitor is that we have challenges around physical space and waiting room space and common areas where people can congregate. And then obviously there's adequate PPE that we need to keep on hand, and there would be a bigger burn rate on our PPE. So we're working hard. Obviously, part of it also has to do with staffing. And if you are interested in being part of our screening team or our EVS team, environmental services team, you can go to haywood.org/careers and help us implement some of these changes faster if we have the manpower to do it. So just an update. I appreciate everybody's patience around that. Also, a reminder, I've been saying it regularly every night, that our COVID testing is available to all staff and all of the community, regardless of signs and symptoms. It's now open to everyone. You just have to call 630-6186 and get an appointment. We queue you up. It's done outside behind the Annex building across from the hospital. I had it done on Monday, and it was quick and it was easy. They were expecting me. My information was ready. It is now an anterior swab, so really in the lower part of your nose on both of your nostrils. I know initially it was I might have it backwards. The swab that's really long and goes up really deep and was not comfortable at all. So this is a much different setup, much easier, and not much impact on your body. So if that's been holding you back from getting your testing, you do not need to worry about that anymore. Just to update, also we have a new video, part of our new initiative, Meet Our Physicians, and it's Dr. Ashley Warner, and so there's a link for you to see that with this email tonight as well. And also all staff were sent a survey to get their feedback from and experiences from the pandemic. If you could respond to that and get that back so community relations can compile that information by Monday, that would be fantastic. There's a link for the survey with this email as well. Over at Athol, just to let you know, MRI is returning to its regular service schedule beginning next Monday. And so that will be Monday, Tuesday, Thursday, 9 to 5. And so that's back up online. And also on the 15th, mammography screening, calcium risk scoring, low dose lung screenings, and bone density will resume its regular schedule on next Monday as well at Athol. So some good things happening there. And I already mentioned, I have in my notes to mention that we need folks to join our entrance control team, screening team, and that just hop online and look at our available job opportunities. Also, if you're a college student home and are looking for a summer job, come on over and fill out an application. We'd be glad. Well, don't come over, do it online. And we will see if we can put you on our team this summer. Some thank yous just to round everything out. The community supports our Alehouse gift card, and the teams at Athol Hospital and the ICU at Haywood enjoyed a wonderful lunch. So thank you for that. And a thank you from Athol's Health Information, Infection Control, and Registration teams who have been treated as well. There's also a gift card at the Blue Moon Diner, and they provided a delicious meal to materials management today. So thank you for that. There's a photo. And then the Boys and Girls Club of Leominster, Fitchburg, and Gardner printed, their robotics team and TPS Solutions printed face shields for us on their 3D printers, and they arrived today, and there's a photo for you to see as well. So thank you to the Boys and Girls Club. Appreciate that work and love having a clubhouse in Gardner for our kids as well. So that's the news for tonight. A little bit of a long edition, but lots to report. I hope you have a great day, and I appreciate everything you're doing to keep us on our journey to be one of the best community-owned health systems in America. Good night.